The Gauteng Health Department said that these 10 affected interns were not yet on the government's payroll system, and officials claimed that they would not be paid next week. Well, they will be paid next week, I beg your pardon. Now, senior doctors at the hospital are now digging into their own pockets and raising funds to help 10 medical interns get through the next few days, while government blames administration issues for its failure to pay them. To share more on this, we're now joined by Dr Mvuyisi Mzukwa, the chairperson of the South African Medical Association. Dr Mzukwa, very good evening to you. Thank you so much for joining us. Welcome to The Full View.
Good evening to you, Simpure, and good evening to your viewers. Thanks for having me in your program.
Dr Mzukwa, it's suffices to mention that nobody deserves to be treated in this manner, especially as we are overwhelmed by the high cost of living. So how do these medical interns get by?
It's a very sad state of affairs, Simpure, where you have young people, young doctors who have just entered the workplace to experience such a horrific experience like they did. We are really perturbed by the fact that the department had allowed itself to fail over more than 2 months, failing to pay, salaries of interns. Some of them are coming from poor family backgrounds, and you would expect that if you have a state or a sensitive government, they would think, along those lines. But you find interns who are now being pushed by government, by the employer, into depression. They are made to fail. They are set up for failure. These are the same interns that must be taken to see patients. And in front of the patients, these interns are expected to smile and be professional and do a quality consultation, whilst at the same time they're suffering in the backdrop of all these things. So that is why we really don't understand why the government would do such a horrific thing to interns or medical interns of this country.
Well, the Gauteng Health Department claims that too many interns were initially allocated to the hospital and that they needed to deal with the admin of creating additional posts. Do you accept this reasoning?
Not at all. I don't accept that reasoning. This is government. Unless you are telling me that government is fragmented, you've got government, South African government that is divided into 9 provinces. But if we are talking about one government, there is no such an excuse. Government talks to government, and these things, they should be sorted out. And if there's any anticipation that interns are not going to be paid, there should be a second plan, to attend to the basic needs of those interns. Now they find themselves being a charity case in the workplace, and having no basic needs, basic amenities, to fulfill their lives. This is a disaster, to this government. Is a failure that I've never seen in my life, where you subject your own employees to such a degrading treatment.
No doubt the medical interns play a very pivotal role in the public health sector. So how has this affected the whole machinery of the hospital operations?
Medical interns are playing a crucial role, like you say, Simpure. It's very important that we have interns.
Yes.
But we know that interns, they in terms of service delivery, they're helping a lot. When they come in, there are young soldiers, there are young lions who come there, enthusiastic, and they make the service go quicker. So if you do not have interns, that that service is going to be very slow. So, if you do this to interns, you are draining their morale, and they won't be able to perform.
Morale is very, very crucial in this particular sector, and senior doctors have now taken it upon themselves to ensure that the medical interns have something to eat and to survive. So how are you raising funds? And for those interested in helping, how do they reach out?
Well, we have, first of all, we welcome and we appreciate, we acknowledge, such a responsibility that has been shown by senior doctors at Baragwanath Hospital. When they saw that interns are being abused by the state, and they came in as seniors, to take care of them. But as you know, the South African Medical Association is always willing. We have encouraged interns to reach out to the South African Medical Association. You know, those that are struggling, they must reach out to us, and we're willing to help them. That's what I can offer now. I've already spoken to some of them now, giving them direction as to what should be happening.
Yeah, so how are you reachable? How do people reach you or the South African Medical Association?
Well, maybe let me just give out my email address. It's Mzukwa, as in my surname and initial, Mzukwa M @gmail.com. That's my personal email address. But also you can send it to chairperson @samedical.org.
Okay, Dr. Mzukwa, great chatting to you. Thank you so much for joining us.
Thank you very much, Simphiwe.
Okay, thank you. That was Dr. Mvuyisi Mzukwa, the South African Medical Association chairperson.